So I was sitting outside in the balcony and I was lost in my thoughts. The sun was at its peak and the air was still. And the time I felt like the time has been slowed down. It was 1:30 p.m. on the 26th of March 2025, a date that was about to change my life forever. Out of nowhere, my phone buzzed, a notification from WhatsApp. My heart literally skipped a bit. I knew what it was. My final year MBBS result. For a moment, I just stared to the screen, afraid to open it. Literally, years of efforts and countless sleepless nights, the pressure, the sacrifices, everything had led up to this one moment. So, after taking a deep breath, I opened the message, and there it was. 802 seat number is passed. I read it once, twice, thrice. My vision literally was blurred as my eyes was welled up with tears. Before I knew it, I was crying, not out of fear, not out of stress, but out of happiness. It was over. The endless exams, the struggle, the moment of doubts. I had made it. Finally, I had earned that one thing I had been working for years, that prefix in front of my name as doctor. So finally, it's Dr. Rakshad Ravindra Desai. I whispered it to myself, letting it sink in. It felt like unreal. I closed my eyes for a moment, letting the moment settle in the heart. So this journey was not just about studying medicine, but it was all about learning, then patience, and what it truly means was dedicating yourself to something bigger than you. This is not just an achievement, but an every late night study sessions, every practical exams, every single vivas that had made my heart raced. And today I want to share my journey with you all guys. So let's go back to all where it begins. So first year, it was 2nd of February 2021, my first year MBBS. I entered the college as a first year MBBS student. So entering medical college was a dream for me at that time, but reality, it hits hard. The transition from schools to the vast ocean of your anatomy, physio, biochem was overwhelming. I still remember my first dissection hall experience. The smell of formalin, the nervousness of holding scalpel in your hand for the first time in the dissection hall. It was all fascinating and intimidating. And literally, physio and biochem, it was like never ending battles. All those sleepless nights before the exams and all those frustrations of remembering those pathways of biochemistry and all those fears of those questions coming in the vivas. It was literally a fearing moment at that time, because all of that was new to me at that time, but somehow I made it and I passed my first year. So that first year taught me that MBBS is not just about intelligence, but it's all about persistence. Then I entered the second year, and second year and third year was mixture of new challenges and a little bit relief. So in second year we were having pathology, pharmacology and microbiology, and in third year we were having ENT, ophthalm and community medicine and FMT. So the second year subjects were a little bit tough because they were pharmac and patho, because we have to remember all those drugs name, all those medicine names in pharmacology. So to remember it, all those names, it was tough at that time. But second year and third year was the phase where it feels like you have finally entered that medical stream after becoming a MBBS student, because in first year you were not having that a clinical exposure, but once you enter the second year, your clinicals get started. You then finally go to the hospital in the wards and you take cases of the patients. So you communicate with patients, you talk with patients, you take history, and you make a good relation with the patient. So in second year, you actually feels that you have become a doctor. You do all the examination part like inspection, palpation, percussion, auscultation. It literally make you feel like that you are a doctor. But there were times when I doubted myself. Was I good enough? Will I make it? At that time, I was seeing my seniors struggling in final year. Hearing about those sleepless nights of internship, it scared me at that time. But I remind myself that I have to do one thing at a time. And then comes the final year, the year of true test, where you are having 4 main subjects, and that is surgery, medicine, your pediatrics and OBGY. And in these 4 subjects, you are again having minor 5 subjects like orthopedics, anesthesia, psychiatry and dermat. Literally each subject felt like entire course in itself. everyday routine was the same from morning to end, like waking up early in the morning, study little bit, completing your daily task sessions, then going for college, then attending the lectures, then going to the hospital for your clinicals, then after lunch again lectures, then after your college is done you go to the study hall, like you study for 5 hours, then you go for dinner, then again you go back home and then again you study, then you sleep, and again the next day the same routine. So literally it was the same throughout the final year, and my goal was clear from day one that anyhow I have to pass my final year exam and have to get that prefix in front of my name as doctor. And just like that, finally I made it. It's Dr. Rakshad Desai that I finally made this thing. But this is not the end. This is just an beginning, and the real journey starts now because we are having internship in few days. So I'll be stepping into the hospital not as a medical student but as a doctor with all those responsibilities of actual patient's care. So now it's the time to put all those study years into action, to apply what I have learned, and of course I'll be taking you guys along with this journey too. My internship experiences, my highs, my lows, and of course all the lessons whatever I've been learning in my entire internship. And so also I'll be starting my anatomy series soon where I'll be going to teach anatomy in the much simplified way. So also I'll be sharing a short medical content videos on my Instagram. So if you have not followed me, then follow me on Instagram. You'll be getting my Instagram link in the description or on the screen. And before I end, I would just say to every medical student out there who are struggling to the same journey, keep going. Trust me, it will be all worth it at the end. And now it's time to go for the next chapter. And if you have not subscribed to this channel, then please subscribe to this channel, hit that bell icon, and please like and share in this video. And comment guys if you need any other video related to medical life or MBBS journey. Thanks for watching this video and be the part of my journey. I'll meet you soon in the next video. Till then, take care. Bye bye.